Hi everyone. I really hope this works. This is about my fifth time trying. Having difficulty with the video uploading onto YouTube. So I've switched from Chromecast to Explorer. So it seems like at least I'm getting further with this than I was using the other browser. Nevertheless, my name is Kelly Deshemy, and currently professionally I work as a Director of Intellectual Disabilities and Behavioral Health for a nonprofit organization called Horizon House in Pennsylvania. We're predominantly in Philadelphia County, but my programs expand throughout the surrounding counties also. I have a few programs within my supervision. I have primarily individuals who are pretty intense, who are verbally or physically aggressive, young adults who tend to have some substance abuse or trauma concerns and really can't stay in your typical residential setting, who need a different level of therapeutic support. I also have an autism services program, which really focuses on sensory and speech and communication needs of adults with autism and supporting them. We've been working with Drexel and Penn, University of Penn, just to try to develop different methods and structure to assist and help them to be as independent as possible. And lastly, I have a forensic program that is a step-down unit. It's a pretty lock-secure unit that focuses on supporting individuals who have a history of sexual offenses and who need to step down from jail but aren't necessarily ready for the community. So that's what I do as far as my job in a nutshell. I directly manage the directors of those programs. I do a lot with finances, program structuring, and development. I also overlook the clinical programs that have been set up by our clinicians just to ensure that they're feasible and that we're billing appropriately and things like that, and that we're within our regulatory compliance. Also, what I really enjoyed about this MSW program thus far is the learning about emotional intelligence. It really hit home to me because a lot of times we look at people, the assessments that we do, the clinical assessments, and the person's IQ, and use that as a guide to how to get the person to get to that next level or to relate to them. But we never really look at their emotional intelligence, which really can have an impact on how effective we are, and looking at the emotional intelligence of the people that we're hiring and that are working with them, because if they're not compatible or if there seems to be some kind of distance between the clinician and the individual receiving services, then we're going to see why the person isn't progressing. And more, without that progression, it just does the person a disservice, the clinicians get burned out, and we won't receive as much funding and support because nevertheless the programs look ineffective. So I was really able to take that back and look up trainings and development programs for our clinicians and directors so that we can take a different perspective when it comes to hiring and really how we treat and support the individuals within our program. I look forward to learning and working with each and every one of you, and I hope you enjoy your weekend, and I really, fingers crossed, hope this works and that you actually were able to hear me. Thanks.